Good morning.
Hello again.
Oh,
You're like, this guy's on stage again. Why?
I've only known.
Promise it's my last time.
I've only known it very briefly. Okay. Hang on. First of all, we put the setting.
What is this?
The fireside chat, man.
Oh, got the fire. Okay.
We are upgrading the meeting as we go on all the time, right? So, Davidek, thank you for the surprise also, because both of us didn't know this about half an hour ago.
Yep.
So my first question is, can you tell us a little bit more, you're the only Chief Digital Patient President, a bit more about you. What we know so far from your presentations is clearly you work for Roche, you've played basketball, right? And you are extremely driven by purpose, because no matter what question it is, you bring it back to the purpose. What else should we know about your background?
So before I go there, I just want to say, this is a legend right here. This is the first chief patient officer in the industry. This guy has blazed trails, and I've seen so many positions follow from that in other companies. So, I mean, huge.
Nice try. Back to the question. So I know you're a scientist by background, all right?
Yes.
And you're also studied at some incredible universities. But tell us a little bit more, how does somebody become a chief digital officer? Because my kids are going to college right now.
Yeah.
There's no course.
No, I guess I would actually challenge you. If you get to know me, I don't like titles and I don't like hierarchies. So in theory, there's no such thing as a chief digital officer, data officer, whatever you want to call it, right? But if you look at the emergence of this role in general, right, and the accountability roles like these have, for our industry, it's actually fairly new, right? If you look at even the financial industry, the incumbents of a chief digital officer actually happened around 14 years ago when went through the financial crisis, and then there had to be a lot of controls within the data piece, right? So that's why they brought in the new, quote, CDOs, right, to really run that. But in pharma, what we're seeing is, and just be clear, we're all CDOs, right? Both data and digital officers. We all have that remit. But it's interesting in pharma because each company takes it differently. Let me peel this back a little bit. If you look at, and I've done some studies on this, many companies are hesitant because they don't understand what it is and what's the role, right? And if you look at just the DNA of a CDO in pharma, around 75% come from external in, so either tech or CPG background, and 25% are organically grown. So I was organically grown through the system. But if you look at some of the successes and failures of those different demographics, it's very wide and spread, and we don't understand that too much. But to go back to your question, how do you become a leader in this digital space? Really is just be very passionate and knowledgeable and be willing to help solve questions and look at solving problems differently. I like the last presentation. The gentleman is moving from commercial excellence to business leadership. I mean, I have general managers on my team, right? That's the rotation. We need people to come in, upskill, go back out, because again, it's not about digital, right? It's about evolving our go-to-market models to benefit society, very simply. Digital CX is a catalyst for that, if that makes sense.
Yep. It's very good. And thank you for sharing those statistics, because I was actually looking for that. So this is an important message for everybody. 75% of the chief digital officer are injected from outside, frequently from telecommunications, banking, even from car industry. And only 25 are grown inside. And this is a break with our history. As pharma, we've been very incestuous. We've been hiring and rehiring scientists and business people, right? And the first injection was very painful, was about 2 decades ago, was the chief compliance officers. For the first time, we put non-scientists, and they were directing the business, and it was painful, right? And now we're experimenting with chief digital officer, chief patient officer, and we see that mix. But David, thank you for saying that. Today, we don't know which of the two profiles is the best, but the result is moving the organization. That's what you said. That's what counts.
It is, right? And you can see examples of, you can bring the CDO of Disney or Nike into some of our companies, and they will completely fail.
Yep.
Right? In fact, but yet you can have someone that's homegrown, and they can fail as well, right? So that's why you need to really be clear on what you're trying to drive as an outcome, right? And make sure it's aligned to the company's ambitions, but also the company's DNA, right? Because each one of our companies has our own niche, and it's not by product, but culture, motivation, family history. It's different, right?
Okay.
And you have to drive that.
Now, I have a question because you challenged the audience a few times with raising hands, so I'm just going to put you on the spot. How many other chief digital officers of the top 20 companies in pharma do you know and have you talked to in the last month? I mean, you're asking us to connect and collaborate.
Yeah. Well, how many CDOs are in this
No,
room
no.
today?
CDOs.
So no, but that's the thing.
Do
We
you
don't
guys
call
know
it-
each other?
Yes, but we don't call it chief digital officers. Every company calls it something
That's
different,
true.
right?
Yeah, okay.
What the question should be around is who's accountable for driving the transformation.
And do you know those?
Many of them.
That's fantastic because that I think is again
The network.
practicing what you were saying. We need to collaborate more, and what I see is that indeed you guys seem to connect easier because you don't have that traditional pharma. Ooh, he's a competitor. I'm not going to tell him anything. And I think that's important. So where did you start? Because if I go back to my experience, the chief digital officer comes in, and as somebody said in the previous, finally they're going to help me. And then what you see frequently is they start with the business processes that need to be fixed, right? The whole management of SKUs and all of that. So how did you start? Because you've been at Roche now a little less than 2 years. How do you start on something like that, as big as that?
Just so you know, not one person can do this. The reason why I'm on the stage is because of my teams, right? I mean, this is all teams driving this, people working day on day to make it happen. So first and foremost, you have to make sure you have the right team around you and supporting you. The focus for this conversation is focus, where the context of my conversation now would be more on that latter end, right? So within the pharma value chain, you have obviously R&D, research, you have manufacturing, you have commercialization, and you have personalized healthcare somewhat. So I like to break it up into those 4 buckets. Piece I'll be focusing on is really that how we show up in front of our customers space, right? Not that we're not supporting stuff in PD and other clinical trials, but the focus for this conversation on this stage, because it can get very diluted, is around that how we show up in front of our customers. To answer your question, where it first starts around is just understanding what's there and what's not. So when I first came into Roche, there was a perception that we weren't as digital savvy as we should be, right?
Okay.
And by that is our customers, very simply, we did a lot of research and talked to our customers, both healthcare systems, patients, providers, and they said, hey, you're not as easy to work with, it's not convenient, it's not consistent, right? And we're like, oh, well, we have the best science in the world, but the other piece is very, instrumental. Specifically, if you look at our portfolio moving forward with all the new rare diseases, indications, et cetera, that's coming out. So we know we had to fix that in. And how you do that is really by putting together a structured framework that sits within the organization, right? So how we're doing that is really we embarked on an overall CX orchestration program, right? And we broke it up into 6 specific areas we can focus. And there's around 20 where you can focus, but we chose 6 capabilities that we want to drive throughout the organization around compelling content. You heard a lot about that through this piece, around intelligent engagement, continuous learning, human capabilities, how we make sure we invest in the learning programs within our humans, integrated channels, value-added services. So we have teams focused on these 6 areas that are driving these capabilities. And how we measure that is we've done maturity assessments through majority of our countries around the world. So we actually know where they rank within these capabilities. And then outside of that ranking, then we have clear personalized roadmaps for each one of our affiliates to understand what are the key things they should be focusing on now within this space to help them do better for their patients, right? So there is a framework that's put in place, but it's simple, it's consistent, and actually, if anyone asks me, if you ask me, what's the hardest part of my job, is actually stopping us doing a lot of stuff that we were doing before.
You've said that before, stopping is so important.
But we don't do it, right?
No, I would
specifically
agree
on
with
the technology side, right? When you have multiple MDMs, I don't go too technical, but when there's so much stuff in the back end, sometimes it's easier just to take a more simpler approach.
Now, the 6 dimensions, which are very helpful for all of us, I can understand that they would be valuable for internal, right?
Yep.
But also versus external. So how do you balance, because let's face it, when you go in a company, very frequently, they're not very happy with their own IT services. And they're like, IT says, but the help desk looks okay. And then people say, but we don't call the help desk because we're not getting help. So there's that internal. How do you balance the internal versus external, which brings us to customer experience after? Who's the customer? Internal and external, both? How do you do that?
Well, our customer is very clear. It's the patient or healthcare provider or system.
Okay.
Obviously, internal, us as people, right? We're all internal customers of ourselves, but the focus is really outside in versus inside out. Because I have been a victim of this in previous roles where I focused so much on internal processes and what was best for us that we totally forgot about what was best for the customer, right? Everything else was just noise.
Okay.
So the focus is outside in, but there was actually a good presentation today around the voice of customers. So for example, we're putting frameworks in place, both frameworks, but also tools to capture from patient start to finish that journey. And within that, there's actually data points, right? And also from a healthcare provider. So then we can actually pick out which are the areas we want to focus on. But that's within one of those capabilities, continuous learning. How do you make sure we start capturing these points and figure out the moments that matter? We're there, make that work. Now, to answer your question about internal, that's kind of out of my scope for now. I'm not focused so much on that, but we do have P&C teams and teams looking at that, but our scope for our department is external.
But I think we still should give credit to you guys because all of us did a transformation overnight from face-to-face to teams, and it worked. I mean, it worked almost. But that was a big achievement because there was a lot of internal resistance before that, a lot of tools, and then suddenly it happened, right?
Yeah, a lot of fatigue there as well, right? So, I mean, it's kudos to everyone in this room and in the teams, right? I don't think we've worked so much before, specifically in this space, where if you look at it, we're in back-to-back meetings from like 8 to 7 every day. That's not sustainable.
No.
So there is some pros and cons. Being the head of digital,
absolutely.
I'm like, sometimes we need to go back to a hybrid, right?
Which brings us back to the customer experience, right? Both internal and external. So that brings us back to measurement. How do you actually measure that? Because I went to a course last year at INSEAD about digital, and what was his name? I wrote it down. Chengi Ling, professor apparently. He said, the one thing you have to keep in mind is digital will not be measured by profitability, but it will be measured by the customer experience, right? And that's an important one because as an industry, we're focused on these. If it doesn't move sales, it's not relevant. So how do you measure and justify the continuous development of digital from a customer experience?
I think you answered that. It's first defining what that measurement is and what's that universal measurement across different countries, right? That's something that we also embarked on is this. We said we wanted to be, and this is not just Roche, many companies, we want to be CX companies, but how are you measuring that and what is the impact that it has, right? So right now we're putting in those measures both from a data perspective, but also the systems that it's capturing. But then the big key that no one actually, I'm surprised we haven't talked about a lot is, it's not about digital, it's really about the value creation, but also our marketeers as well. Like we still have, in marketing as in getting the messaging, getting the science to the world. We're still working with teams like that, and they're part of our team on really shaping, once we get this information, how can we actually use that to better the outcomes we're trying to drive? So capturing it and getting the universal way of doing it is one thing. Getting us to leverage that information and data and power to drive tangible action, that's still, we haven't solved that yet.
Okay. So basically if I understand you correctly, there's one thing getting the insights, but if the insights don't lead to a change, it's a wasted insight.
Correct.
And how do you ever capture that part? Because it's very similar to what I was doing in the patient affairs. You look for insights from patients.
Yep.
But then the patient says, so what did you do with my insight? And as an industry, we're really struggling to prove that. Any hints, any suggestions? What are you working on? Can you tell us?
Well, it depends, right? So let me just even take a step back around this. I'll be very niche here around Roche. Think about the next 10 years, right? We broke it down to 3 specific horizons. The first horizon is going to be around what we call a stakeholder play, right? So really putting in some of the foundational measurements, systems, people, processes, et cetera, to make sure that we're running. The second piece is called integrated healthcare system play, where within Roche, we have Flatiron, we have FMI, we have diagnostics. How can we pull all these solutions together to drive one specific solution? And then the last horizon is around truly ecosystem play, right? We're truly trying to partner with healthcare ecosystems around the world to drive better patient outcomes. So this is all part of that. And the piece why I brought that up is because insights is a big key there. That's why we made an investment in Flatiron previously around just that insights piece. So don't have an answer, but we're working on a lot of things on what that looks like from just driving better outcomes. But we don't have an answer there.
Okay. So back to what you said several times, stopping things. If I listen to the patients, the one thing that they tell pharma to stop is stop making product websites.
Yeah.
But many marketeers still continue. Would you agree to that from your perspective? Or is there anything else very tangible that people in the room can go back tomorrow and stop, pull the plug?
Yeah, that's one thing, but also open yourselves up to the society and ask, right? So we actually, this weekend, we partnered with MIT Hacking Medicine, and we had a really great event where, very simply, how do we make sure we can effectively get this scientific information to the world? right? And we open it up to everyone, whether it's big pharma, small pharma, startups, physicians. And we had close to 400 people, whether physicians around the world, startups, et cetera, come together on Slack over the weekend, invest their time and energy to come up with solutions, right? And with that, that's how we get what that next iteration looks like. So it's not built within, it's how do you reach out to the network to understand what's best and then accelerate, build that, and catalyze that.
Yeah, but it doesn't answer my question because it's still adding something new, which is great. And I want to be there next time, invite me.
Yeah.
But what are you stopping?
Oh.
What is something that people can go home and say, tomorrow I pull the plug on?
Well, very tangibly, right? So for example, in one situation, we have around probably 50 plus global scientific medical sites. We're going to bring that to one, right?
Okay.
Very simply, right?
That's a good one.
But I mean, that's just, anyone can think about that, right? But the question is, when you bring it to one, how do you make sure, A, you understand why those other 58 popped up, right? Because I'm sure there's some reasons behind that rationale and someone's baby. But then ultimately, the person at the end of that that's receiving that, how do you make sure they get the outcome?
Yeah, okay. I can do another suggestion from the patient side. A lot of us are investing in apps for example, adherence, right, for the drug. But most patients take more than one drug. I was recently meeting with a mother and she said, my daughter takes 8 drugs for which I have to do 5 adherence apps who don't communicate with each other. Result, I don't use any. So maybe back to your previous one, when you're in an indication, you want to do something, do it together with the others in the indication, and that would stop a lot of extra work.
And real quick, before we close, and often I have a lot of people come to us trying to create what I call like a quantum leap, right? Because I think people have good intentions, like they want to solve these problems, but how they're approaching it is not sustainable, is not working, right? So many times they're like, I'm trying to get from this step to that step. But again, literally, it's almost like a quantum leap, right? And I'm telling them, guys, put one foot in front of the other, right? And next thing you know, when you look back and look down, you scale that mountain, right? So you're not going to go from Mount Everest from the bottom to the top through a quantum leap, right? Superheroes only exist in comic books, right? So you need to figure out how can you encourage people just to take a quick step. Don't engage on these 1, 2, 3 year long projects, but iterate and exponentially grow on top of that, right? And that's as leaders, as we are in this room, encourage your teams, right, to just continue to take those little wins and build on top of that. Because anything successful in this world, that's how it's created, right? You don't just come out with a bang.
Davidek, thank you very much, because you've summarized what leadership is about. Because on the one side, you said, keep your eye on the prize, always keep the vision, what you say, the patient, but do it baby steps, but never for little. Thank you so much for your time.
Thank you.